Hey everybody, this is Dr. Zarinah. Come on into the broadcast. It's 5:30 on October 29th, 2017. Come on into the broadcast. This is Rebound Your Health TV with Dr. Z. And I am here. We're going to be discussing, this camera, right? We're going to be discussing 10 tips to help relieve back pain. So welcome to the broadcast. Hey there, everybody. Come on in. Thank you so much. Hey, Travis, thank you for coming. Hi, Dr. Nicole. Thank you for coming. Welcome to the broadcast. Please invite at least one friend. Sharing is caring, and it's going to help information. Hopefully can help you or somebody else. 10 quick tips. Hi, Sharifa. Thank you for joining. Welcome to the broadcast. Hey, Dr. Nicole. What's up? Thank you so much for joining us. This is October 29th, 2017. I'm blessed and happy to be here to share with you guys this quick information. Some of you might have heard of some of this information. Some of you may have not heard of any of it. Either way, this information is going to be helpful to you or somebody else. So please click share notification below. How you doing, Dr. Kwanzaa? Mwah. Thank you for joining us. Welcome to the broadcast. Please share. I'm going to hopefully share some information that none of you have heard, or some of you have heard of some of this. And some of this is going to be recaps from my colleagues out here. But sometimes we forget to remind our patients of sometimes the basic things because we're in a rush. But also for the patients that you guys out here, my MVPs, are chiming in. Hi, Ayana. Thank you for joining. Welcome to the broadcast. This information is going to be helpful to you because you may have never heard of it, or you've heard of it, you completely forgot about it, or you just don't know how to apply it. That's a big thing, actually. We get in our office a lot of times like, oh, yeah, I heard of that, but I wasn't sure if I was doing it the right way or if that was applicable to me. So the information I'm going to give it to you today is going to be pretty universal. So no matter what kind of back pain you have, this is going to be good information. Hey, Jeff. Wow. Thank you for joining us. Blessed that you're here. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z. And you are here going to be learning 10 tips, guys, today to help you relieve that back pain, or you going to share with someone else, right? Everybody listen to my voice. You are MVP. You must be the most valuable person in your life, because you cannot be anything to anyone else if you're not the MVP in your life first, okay? So everybody that chimed in, y'all are all MVPs, so you definitely need this information so that you can own that information and be able to pass it on to those that you love and those you care about, okay? I'm gonna give it maybe 60 seconds. Y'all tell me how y'all been. I'm giving 60 seconds for a couple more people to join in with us, and also to give you opportunity, please click share and share this. Invite at least one person to this broadcast so we can share it with this information together. I want you to write down these tips into the comment section, please, because that's going to help someone who may be watching the replay of this, and also if you're listening along and you missed something I said. You guys, we're all MVPs together, okay? So we're going to be a team today. Participate. Guys, I love you guys for always being there for me, okay? And for each other, quite frankly. Must be the MVP of your life. Yes, Ayana, absolutely. I want everybody to affirm that in your life. When you wake up in the morning, make sure you say that to yourself. That is it. That's why I call you guys my MVPs every day, because you're the most valuable person. Whether you know it or not, I'm here to remind you that you are the MVP. You're the real MVP, all right? I'm just a player on the team. Hi, thanks for joining us. Okay, let's jump right into it, guys. Thanks for coming in. Invite one person at least. You can invite more. I'm not gonna stop you from inviting more people, but definitely want to jump into this. 10 tips, okay? 10 tips to help relieve your back pain, and we're gonna jump right into it. Number one, and again, before I actually jump into that, I will put the slight disclaimer on it. Everybody is slightly different, right? So in general, this information is going to be very applicable and very safe, no matter what kind of back pain you may have. But of course, always confer with your physician to make sure that there's no other reasons that you cannot abide by these tips. So that's a disclaimer I always put on that, because the best solution, of course, is always to, if you're having some lingering back pain, especially if it's going on for weeks and weeks, get in to see a specialist. It's actually going to talk about that in a little bit. All right. So number one tip is limit your bed rest. Somebody type that down for me. Limit your bed rest. Most of you out there want to lay down, right? You're hurting. You're like, oh, I need to stop and sit down somewhere, lay down somewhere. And the forefront of your mind, that makes sense to like rest. But actually you want to limit bed rest, because a lot of studies support it, as well as really just real-time clinical experience as well, is the more you're laying down, the more you're resting, so to speak, you're lying down more because you're having pain in your back, you're actually going to increase your pain and decrease your function. So what happens is when you're laying down too much, of course, you actually can lose muscle mass over time. So when you're losing muscle mass, then when you start to try to get to move and you're already having some inflammation in that area or some kind of disruption in your alignment, then that rest actually is gonna, too much rest is actually going to exacerbate that and make your pain worse, okay? Thank you, Yana, MVP. Yes, you're right on top of it. Limit your bed rest, okay? And don't forget, guys, if you have questions along the way, just go ahead and shoot them at me. Sometimes there's a slight delay because of technology, so it might be a slight delay in me answering the questions, and I always answer the questions or go to my comment section right after this live broadcast so I can get to any questions that I may have not gotten to, okay? But if you have any questions, for sure, jump right in. Hi, Zakia. Welcome to the broadcast. Welcome to the broadcast. Mwah. Rebound Your Health TV with Dr. Z. It is me. And we're talking about 10 tips. Let me back up because some of you actually don't know me. I am Dr. Zarinah, also known as Dr. Z, your integrative sports medicine specialist, here to help you rebound your health, ultimately obtain pain freedom through my concierge practice and my telemedicine, speaking engagements, authoring. I try to bring this information to you also with this online health TV show here to make sure that you have the information you need to empower yourself. Hence, that's going to empower your body to ultimately help you live your best self, right? And that sometimes pain freedom is pain here, or even physical pain. And oftentimes we often miss that pain, physical pain, is sometimes exacerbated because of the mental pain and the emotional pain. So I address you as a whole person. Hence, I am your sports integrative medicine physician. Okay, that's for those who don't know me, and I don't want to miss that as well. Okay, absolutely, you're welcome, Dr. Mr. Kia. All right. So number 2, keep exercising. But that's in moderation. Number 2 is keep exercising. Somebody type that down for me. And again, that may sound like an oxymoron as well, right? Because you're kind of thinking, well, I hurt and I hurt when I move. Why would I keep exercising? Well, I'm saying that in moderation because it actually goes along with the first tip that we said when I said limit your bed rest. So number 2 is keep exercising, but in moderation. Okay, exactly, but in moderation. You want to do some light exercising because the idea is that you want to keep moving. Motion is life, guys. And at the end of the day, if you start to not move and you're resting too much, you're sitting down too much, you're lying too much just because you're in pain, what actually you're doing is causing more restriction in that area, and it's going to be harder and harder to kind of come out of that. So we want you to keep moving, keep the blood flowing right now. So it helps with the blood flow to that area. So you want to keep that going, but it is in moderation. What is moderation, Dr. Zarinah? What does that look like? That may be meaning walking. I'm not telling you if you're already an athlete, which if some of you are, many of you are who are listening to me today, you actually are athletes or athletes in the head at least, right? So either way, you kind of want to keep moving, and that's good, but in moderation. You want to keep walking. You might do treadmill walking, but sometimes treadmill walking can exacerbate your pain too. You're like, oh, well, that kind of banging sensation or pounding sensation, can make your pain feel worse. Well, then I'll tell you, walk in the pool, find a pool nearby. That can be very helpful. Even if you have a jacuzzi, for instance, get in that pool and do some motion. If it's deep enough, jacuzzi tub in your bathroom, then you can put some Epsom salt in there and get the body moving. I would say that's after if it's been 72 hours, then I would promote maybe a warm bath. But in the first 72 hours, we'll get to that in a minute, why I'm talking about that. But number 2, keep exercising in moderation. You can either just do some light walking, not necessarily too much jogging in the first week, but definitely keep moving, as well as you could get in the water. That's really helpful for a lot of people who have back pain or you have knee arthritis or arthritis in your back. That can be very helpful. Okay, so if you guys have any questions about that, go ahead and let me know. I'm definitely kind of trying to keep an eye down there on the comment section. All right. Number three is good posture. And some of you, I noticed that did chime in today, and we've seen, see guys in the office sometimes, or EVPs, or seeing you out at different speaking engagements. Good posture is a big deal. We talk about that quite a bit because that's probably one of the bigger things that people are just really bad at. You might be strong, you might be an athlete. Again, athlete in your head, either way. But your posture is actually exacerbating your pain, and even can be the culprit for why you have the pain in the first place. Because some of you, and answer me this question, some of you could raise your hand or virtually raise your hand. You may not even had a car accident. Maybe you didn't have a big, bad injury per se, but all of a sudden gradually had this gradual onset of pain that increasingly got worse over the years or over the months. And you kind of can't punch your finger to exactly why. And I'm here to tell you, if you think back, Sometimes you still can't think back to where it caused, but bad posture, because we don't even think about it, it actually is a big culprit in a lot of people's pain. And if I can correct that and help you correct that, and actually do some different tips inside the office with you, when you're part of our, practice, when you come part of our practice, we go through a gamut of a very comprehensive evaluation and assessment to assess your posture and then give you strategies to help you fix that posture so that long term you have a better posturing, right? And that's going to over time help you with your back pain and neck pain, quite frankly, okay? So that's a big deal. And I'm talking about walking posture, sitting posture, so on and so forth. So number 3, thank you MVPs out there. You're typing that in. Thank you. Good posture was number 3. They should take a stability ball to the office and use that instead of a chair. Yes, I've done that multiple times. Some people think that's quite funny. I will touch on that in just a second, actually, because I'm glad you brought that up. In fellowship, everybody used the stability ball instead of really office chairs. We use a stability ball to sit. And that does a couple of things. One, it does kind of promote it and force you to have a better posturing, because you almost can't stay on the ball, not effectively at least, if you're not using good posture, which in turn, of course, that means you also have to use your core muscles, which is awesome, right? If you use your core muscles throughout the day, you're going to burn some calories. And who doesn't want that? I don't care what level of fitness you are, that's going to be beneficial, because we know also in the literature and the research that increased abdominal girth is actually linked to a lot of things such as diabetes, cardiovascular disease, and even cancers. So in general, I'm not saying the stability ball is going to cure you from all those things, but that's one added thing that you could add to your life, because it's going to help improve your posturing, which is going to in turn help your back pain and your neck pain. Hi, Dr. Ashara. Thank you for coming. Hi, Nura. Thank you for coming. Mwah. Welcome to the broadcast. It's Rebound Your Health TV with Dr. Z. You guys listen to 10 tips to help relieve your back pain. And we are what number are we on our MVPs? Number 3, I think we are. We're talking about good posturing, how that is extremely important to helping you benefit and relieve your pain, be it neck pain or back pain. So really, I know the title said back pain, but these tips I'm giving you guys is going to actually help you with neck pain too. So let's just narrow that down to spine pain, actually, okay? The spine itself is going to be very, very beneficial. Always check with your physician if you have some other diagnoses and medical conditions that may or may not be a reason for you to introducing any new exercise regimen to your day, okay? To your regular, to your day, all right? But thank you for Ayana for that tip, and thank you for chiming in about the stability ball, because it has multiple benefits. If you want to just kind of add something that's not, too big of a deal, it doesn't really have to take too much more out of your day, but it does have those benefits. Again, you're improving your core posturing, your core muscle and your core strength. That's going to decrease your abdominal girth. Of course, diet plays a role into that, and too, in terms of improving your abdominal musculature, if you will, and decreasing the fat around the abdomen. But it does decrease abdominal girth. If that is the case, going to decrease your risk for cardiovascular disease, decrease your risk for diabetes, as well as many cancers. Okay, so that was number 3. Number 4, let's get this in, MVPs. Number 4 is core strength. That's a good segue. We were just talking about that. Actually, I have that written down as already is core strengthening. And the funny thing is, in the medical world in general, when we say core, and actually I'm gonna ask a question. When I say core, strengthen your core, what's the first word that comes to your guys' mind? Y'all go ahead and type that in and let me know. When you hear core and I say core strengthening, what do you think of first? I'll give you guys a second to answer. Thank you, Ayana. MVPs are on it. You guys are on it. I love it. I see it right there, core strengthening. Yeah, when you first think of core strengthening, what do you think of? Is it a particular muscle group that you think of? Is it a specific body part that you think of? Okay, Ayana says she thinks of ab work. That's a good idea. Ashara said, Dr. Ashara, stomach, ab work. Yeah. Nicole Evers, Dr. Nicole, abs and back. There we go. We're getting there. And Nura said common answer is abs. Absolutely. All great answers. Yes, 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 and yes. And all of you are actually right? All of you are correct in that statement. But I take it a step further, and it might just be a unique Dr. Z-ism, if you will, or Dr. Zarinah-ism, which I take it a step further, because what I know is that some of my patients come in and they have pretty good, but I think form stomach to knees. You're giving it away, because I know some of you are in my head, and I love it, because that means some of this stuff is sticking from even previous encounters. But that's awesome. Yes, teach. We're all teaching each other. Go ahead and let that in. Absolutely right, Nora, with that one. That's exactly where I was going, was expanding that core idea, that our core goes from right below our chest, all the way down to our mid hamstrings, if you will. That's why I look at it. The reason I say it, because that is essentially the bare bones of what holds us up. And a lot of times I find that, I do have patients that come in and they don't have abdominal girth, right? They don't have a bunch of adipose, or I'm using all these fancy words, adipose, some call it fat, or, they're not necessarily obese, but they have back pain and they may have fairly strong abs, but you know what they lack? They lack strengthening in the areas that are, I would call the accessory muscles of the core at least. And when I think of that, I think of the quads, I think of the hamstrings, I think of the glutes. And some of you know, when I've tested you, we go through different workshops, and I'm saying, okay, yeah, your arms are strong, I'll give you that. But then we test what? We may test your hamstrings, your quads, your adductors, those muscles that's on the inner part of your thighs, and those are weak. And what I find is those are big culprits of why you have that back pain, because that's where it's gonna go to your weakest link. And those are extremely important to be strong in order for you to have a full strengthening of your core, which in turn is going to help your back pain. So thank you. The isms. Exactly. You like that one. All right. You guys are awesome. Thank you for chiming in. Absolutely. So yes, core strengthening is extremely important. That's another way to help relieve your back pain. If you feel like, oh, my abs are strong, Dr. Z, Dr. Zarinah, I got that. But let's test your hamstrings, see how that is going, because I bet you, more often than not, that's a lot of times where the culprit may be aligned. Even with my bodybuilders who may be listening to me right now, or my CrossFitters, sometimes we neglect those other like non-sexy, muscle areas that you can't look at, but they're hugely impactful when it comes to your function. And if it's impacting your function, likely it's going to impact that spine, which means your neck and your back are going to be vulnerable to injury if you don't have that strengthened as well. So awesome there. Okay. I need to work on my hip adductors. Yes, that's exactly what I'm talking about. Those abductors, those glutes, those quads, those hamstrings, those adductors. All of that is very, very important. Okay. And then the other thing that my mentor used to say to me when I was in training, and I've kind of continued to use it because it was so true. And actually the literature supports it. So it kind of sounds funny. What he says is that your back goes out because your front goes out. What that means is, if you can imagine the curvature of your spine, and you're looking at it sideways right now, right? Well, everybody's supposed to have like a bit of a lordosis, but when that lordosis get further exaggerated, a lot of times, because if this is your abdomen and then the back here is your buttock, it's because the abdomen got further out here. Okay. So then what's going to happen? That creates the weakness. If you can imagine, this is my spine and it's becoming more, malaligned because you have so much girth out here, or abdominal girth out here. Well, your back's going to go out. So when we can bring the abdominal girth, the abdominal fat, and strengthen the core muscle in here, then the spine does straighten up, and it allows us to have a stronger back as well. So that's extremely important, guys. I hope that visual was pretty good. But outside of not having a chalkboard or something, I have a question here. Like when you had me lift my legs on my hips, and you kept saying, hold it, and it was in the tape. You told it. I'm not going to call anybody out, but definitely important to just make sure that you're strengthening our core and it goes beyond the abs. Absolutely. Thanks for chiming in, Dr. Shar. Thanks for chiming in. Okay, so that was our number 4. Are we still on key, guys? Are we still on key? Number 5, somebody write this down for me. Increase your flexibility. I just had this conversation. I can't remember with who, but literally just yesterday, and we discussed flexibility versus strength. And it's not really a versus, quite frankly. They are cousins to each other. And I promise you this also, if you are a strong individual, because some of you athletes in your head, either one, I love you, MVPs your situation, right? At the end of the day, if you're strong but you lack flexibility, that's also setting you up for back pain. So what happens is when those muscles get really, really tight, for instance, then that's creating, that's setting you up, that's setting your spine up to not be able to have the mobility that it needs. And also restriction can cause pain. So increasing your flexibility is extremely important when it comes to, relieving your back pain. Some ways that you can do that, some tips I tell people: when you first wake up, after you thank the good Lord above, or you thank the Creator for waking you up, after that, you need to be stretching. And sometimes what I do is that's the first thing I'm doing before I even put my foot on the ground. There's some stretches that you can do where you're going to try to lengthen the muscles in that back, okay? Or even take your hip, whatever side, it doesn't really matter because you want to do both. You're going to bend your waist, you're going to bend at the waist and bring your thigh up towards your stomach, as you can imagine, right? So you're going to bring your thigh up towards your stomach. You're going to bring your torso away from one side, and then take that hip and cross it over the other leg to the other side. And so what you're going to do is basically stretching one side of the back, and then you're going to do the opposite on the other side and stretch the other side. And you can do that right before you even get up, guys, because what happens is that restriction, again, we're still talking about flexibility. We're still on that flexibility. Tip number 5, exactly, to make sure that you're stretching that right before you get out of bed. That's extremely important. OMG, I am a mess. I have no flexibility and I'm strong. OMG, you are describing me. Absolutely. Well, we can help you definitely with that at Rebound Sports and Rehab. We can definitely help you that. So don't, I'll give you guys contact information, how I can better help assess your issues or what to get you to your next, to make sure that you don't have to have that issue. You can be the NDP again, rebound your health, and have pain freedom. Okay, so I can definitely help you guys with that. Another way is hamstring stretching. Again, that's an extremely helpful one. If you just kind of keep your heel on the ground and raise your foot as high as you can. And then what you're going to do is you're going to lean back a little bit, but then flex at the hip forward, and you should feel a stretch right through that hamstring. That's a little simple one. It's very simple. You can do that in the shower if you're like a morning shower person. Again, excuse me, that warm heat and moist heat, as we've kind of talked about in the past of some of our other prior episodes, that moist heat in the shower is very effective with helping to prepare the muscles to receive that stretch. So doing hamstring stretch such as that in the first thing in the morning can be very, very helpful. So something that I want you guys to think about. And then the foam roller. We talked about that a few episodes ago as well. If you want to catch that video, you can actually follow me on YouTube at Dr. Zarinah. That's DrZarinah. There's some videos about that when we discuss the foam roller. Foam roller is going to help also improve that flexibility in that area. So again, we're talking about flexibility, helping to relieve your pain. Strong but no flexibility, pain. Flexibility with no strength, pain. You need both. Okay, that's the point of it. All right, number 6, guys. Let's get into it. Number 6, ditch the back brace. Just throw it out. Well, not all the way, but it's extremely rare where I'm going to recommend or encourage a back brace. And I know y'all love it. Anybody out there right now listening to me that has a back brace, y'all love your back braces. But the reason we don't in the medical field really support it or encourage it is because it can it can worsen your back pain by virtue of the fact that the longer you wear it, it's going to increase or decrease again, actually your muscle integrity in the muscle is going to increase the muscle weakness. It makes your muscles weak because now you're not actually using the muscles. It's almost like the brace is taking over that. So in a nutshell, that's in layman terms at least, but essentially the back brace becomes like a crutch, so to speak, and that can actually worsen your back pain because the muscles underneath that back brace will become weaker and weaker. So in the event that I recommend it in general, if you must have the back brace, I would say with heavy lifting. If you're someone that works for 12 hours and you're doing a lot of heavy lifting, 20 pounds or more during your workday, then that makes sense. But even then, you want to intermittently wear it, again, to kind of protect the musculature and the stability of your back. Because if anything, it could actually create more instability if you wear it too long, okay? So that's number 6. Don't marry the back brace, okay? Don't marry the back brace. So that's a big one. And then if you have to wear it, limit it for less than 30 minutes a day, okay? That's really that. You got to have it on. Think about what's the worst 30 minutes of your day and put it on then. And then try to do it even less, like 20 minutes at the most. And honestly, that's the best. That would be my recommendation in general. There are some exceptions, like I talked about. But again, you want to seek consult with your physician or reach out to us so we can assess if you meet that exception or not. Most likely you don't, and there's other things that you need to be doing or that we can help you do to get you to your next so that you don't even have a need for the back brace, okay? And at the point, you want long-term relief anyway, not that, kind of temporary crutch or temporary Band-Aid. Number 7, ice heat. Which one? That's what people always ask. Well, which one is best? Some physicians, and many physicians will suggest number 7, ice heat. Somebody write that down for me. Ice heat essentially is going to be what you prefer, actually. When you first hurt yourself, if it's acute or you have an acute flare, a lot of times it's an inflammatory response or swelling even that can be the culprit of your pain. And in that case, we would recommend ice within the first 48 to 72 hours. And then after that, kind of pull away from the ice. And more likely then you want to use that moist heat. Okay. And then even then you can alternate if you need to, because sometimes there is a double whammy or a double component happening where there's some inflammation that's causing the pain or some swelling that's causing the pain. But then the heat helps you because you also have some muscle soreness or tightness. So it's not uncommon that I have recommended for some patients. Again, you want to make sure that's appropriate for you, but ice and heat or alternating the two can sometimes be helpful, but definitely within the first 72 hours, I would say avoid the heat and try the ice. Okay. And how you want to do that is 20 minutes on, 20 minutes off. You don't want to overdo it. And my disclaimer for diabetics, if you're diabetic, I'm not even if you're pre-diabetic, you just want to be aware of the temperature, because what happens in diabetes is that you have a decrease in sensation because of that, the diabetic process that happens physiologically or metabolically. And sometimes you don't have the sensation, what we call diabetic neuropathy. Some of you know you have it and some of you don't. So it can be very, very dangerous actually if you leave ice or heat or anything with temperature change on your body or your skin for too long, because it can cause damage and you don't realize it till the damage is already done. Okay, so that's important. Again, talk to your doctors about that to make sure what's best for you and what is the best way, appropriate way to use that. Okay, so some of you are not maybe diabetic, but you have a parent that might be, or aunt or uncle or sister or whatever. This information is for them. So click share or share this video after we're done, or something to that effect. Make sure they have that information because it's extremely important. Okay, so that was number 7. Number 8, sleep. Extremely important. We meaning experts as experts in the field when it comes to pain, is that pain in general, but that sleep, if you don't get enough sleep, that is going to exacerbate your pain, period. So sleep is huge. A lot of you out there don't get enough of it. I'm actually one of them. I don't have pain, thankfully. But sleep in general can be very, very impactful, to your overall health in general, but also what we're talking about today, I'm talking relieving your back pain. Why is that? Because you have to actually go into a certain level of sleep. Sleep has these cycles and phases. And if you don't go into a certain level of sleep, hence REM sleep, for instance, where a lot of cellular turnover and repair that happen, that what the repair from the day is happening, but you don't actually get into that part or that phase or cycle of your sleep, then you miss that. You don't even get the opportunity to have that aspect happen adequately enough, or it's ineffective, or it's inefficient or insufficient enough amount. Hence, you don't get enough, so that can also exacerbate your pain, which also because your cortisol levels can increase because of that stress level that increases when we have lack of sleep. And in turn, when the cortisol levels increase, so does our pain as well as our abdominal girth. So a lot of other things happening in that process. I promise you guys, sleep is so, so important. Again, we can help you. I can help you kind of figure that out. We do go over sleep hygiene and strategies of how to improve your sleep hygiene. Some of you are kind of doing some things, but maybe you're doing it out of order, or maybe you don't quite know what you're doing. You just kind of heard some things and you're not sure if they apply to you or not. Again, those are the kind of things that we help tease out for you when you come and do a full comprehensive assessment with us, and we'll help you guys do that. Okay, that's a problem for me. My sleep pattern sucks. I know. Well, we can help you, and your sleep pattern sucks. I would ask the question to you, Ms. Ayana, as it relates to your sleep pattern, is what your day is like, and then do you have an actual routine? So routines are extremely important, even though some of us don't like it. But establish a routine where you're actually saying, I'm going to do this at 6 p.m., do this at 7 p.m., 8. You're actually writing that down, and then try to stick to a pattern such as that. Again, we can go into more detail because sometimes you have to finagle that a little bit, depending on your lifestyle, depending on what's happening in life in general, but it's absolutely critical that you get sleep. So reach out to us, let us know how we can further help. And I actually think I have your contact information so I can get to you really quickly. All right, number 9. Number 9 is smoking, guys. If you're MVP out there, some of you are still smokers, but in order for you to be your best self and the most valuable person in your life, you know that you have to value that temple that you're in as well. And I got to get you to stop smoking, because the literature, the research, is strong evidence, guys, strong evidence, and supports that indeed it does exacerbate your pain. I can't quite get you to your next a lot of times when we're sabotaging it with smoking. So that's a big one that we know. And why does that happen? Why smoking? Why is smoking a big deal? Why does it make my pain worse? If anything, it relaxes me, Dr. Zarinah. I get that a lot. I pull out a cigarette because it kind of relaxes me because, I'm in pain. Well, contrary, my friend, what is actually happening is causing further and further vasoconstriction. And you know how we talked about blood is life? And it's like the life that really, really helps. Hi, Samika. Thank you for joining us. Welcome to the broadcast. You're here with everybody here, Rebound Your Health TV with Dr. Z. Thank you for joining us. I hope this information you'll find valuable. If you do, please share it and invite a friend to come on in with you, okay? So essentially, yes, smoking can cause vasoconstriction, which means you're going to decrease the blood flow to that area where the pain is. And of course, you need those vessels to be open so you can bring blood flow and fibroblast and those growth factors is going to come help reparative, I would say, compounds that are going to come to the area to help build and repair that area. But if you're smoking, you're just zapping that out, completely zapping that out. And that's not going to help you whatsoever. So that's extremely, extremely important. Okay, guys, smoking, stop it. If you're not my smoker, that's fine. High five, give me one. That's great. But you probably know some smokers out there and they have back pain and they haven't made the connection. But now you do. Now you have the information. So share it with them. Let them know. And if they don't believe you, send them to this video. Share it with them and maybe they'll listen to me, possibly. But definitely we want to get them off the tobacco. Get rid of the cigarettes. That's another one. Ditch the brakes, ditch the cigarettes, okay? Ditch the smoking. All right, that was our number 9. Number 10, we're almost at the end. Here's our number 10. Number 10, if none of these things help, or they help some and they're kind of getting you a little better, but you're like, I still need a little something, then come see me. That's actually number 10. Not specifically because maybe you don't live near me, but go see a specialist. That's my point here, right? Someone who specializes in pain. And in particular, of course, I'm biased and I believe that integrative pain management is extremely important because what we're going to do at the office is address your pain from the inside out as well as the outside in. So we're going to come from 2 directions to make sure that we get you to your next long term. Okay, we're not really about quick fixes or short-term relief only. I take that very personal, quite frankly. So I'm going to be with you the whole way. You guys are MVPs again. I need you to be quite available for yourself and available to those who you love in your life. So extremely important that we get you to the next. And that's going to require inside out, outside in. And actually the MVP again on that team is you. And I'm here to assist. I got you. I'm the coach. I got you. I'm not going to leave you. I'm going to stay with you. But indeed, some of the things that we can do in the office, again, goes from an integrative nutritional consultation. We do a full assessment of that, of what is coming in your body, what is not going in your body, what do we need to be in your body, what do we need to take out of that routine, okay? We discussed that very, very thoroughly in very much detail. Then I will go assess, of course, any MRIs, X-rays, nerve studies, anything you've done, or order some if they need to be done. We also have an ultrasound machine in the office, so that allows me to, in the spot, on the Johnny on the spot, put that probe on the area of concern, and oftentimes I can diagnose and treat on the same visit, because I have that tool available to me to be able to dynamically identify if there's any issues in that particular area that I could treat on the spot. And then also we're going to be assessing your sleep hygiene. Again, we talked about that. Some things you may be doing are right. Some things you may be doing are not so right. We have to make sure what is the best fit for you and your lifestyle and how you approach life. What is your job? What do you do for a living? Be it a stay-at-home mom, your nurse, your teacher, your doctor, your executive, whatever the case may be, that's going to be extremely important, okay? And then, what else do we do in the office? We do a lot of things. The point here, guys, is that it's extremely comprehensive assessment. And what is Hi, Dr. Tony. Mwah! Thank you for joining the broadcast. Thank you for joining us. Sharing this, caring. Share if this information is important or helpful to somebody that you know, and please catch the replay. That might be helpful to somebody as well. Thank you for joining the broadcast. But definitely, guys, for sure, the full assessment, you want to go to someone who has the expertise in that and be able to assess you from a complete basis, okay, from the head. Because also your emotional stability and your stress level, we address that as well. We also have a psychiatrist with our group, Rebound Integrative Medical Group, who is also very thorough when it comes to that as well. So we work together to try to address those emotional and psychological aspects that may be impacting your pain. So again, guys, you're all full person. So you might come on with shoulder pain or just back pain. just back pain, right? But you're a whole person. We have to address you as a whole person to get to the root of the problem so that you have the tools, you're equipped and empowered to do exactly what you need to do to be your best self, which is what? Be the MVP of your life, all right? The MVP of your health. And I'm here to help you get to the next, all right? So love you guys. Thank you for joining me. This is Rebound Your Health TV with Dr. Z. I am Dr. Zarinah, your integrated sports medicine physician. No, I don't just treat sports. I treat you as a whole person from the pain, get you to pain freedom, or pain freedom of the body. At the end of the day, that's what we're here to help you get to through my concierge practice, telemedicine, authoring, and speaking engagements. You can actually reach me at info@drzarinah.com. That's our email. That's info@drzarinah.com to reach out to us for your free, no obligation consultation, 15 minutes virtual office visit to let me see and help, so I can help you identify how we can best help you to get you your next. Do we need to do anything further? And just to give you some tips and some ideas of how you can get to your next. So again, that's info@drzarinah.com. info@drzarinah.com so I can help you. No obligation, free consultation, 15-minute consultation, virtual office visit. Let us help you get to your next. I love you guys. You guys rock. Go be MVPs for the rest of the week. So I see you next week. We're going to keep rocking and getting there, okay? We're here with you guys. I'll see you guys next week. Thank you for joining us. Mwah!